And welcome back to Body Beautiful. With us today we have plastic surgeon Dr. Joseph Mele, and we're talking about liquid facelifts. We'll be taking your calls, answering any questions you might have for the doctor. Here's the phone number, 415-561-8753. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And our little caveat before we get started here, any advice we give you today, you'll always want a second opinion. It's a good idea. The safe way to go. We were talking about, it's gravity, it's age, and all the ravages of time and what happens to our poor bodies. Short of taking a rocket to the moon or living in outer space where there is no gravity, there's not a whole lot we can do. Although they're constantly trying to invent new things. There are lasers out there, there are chemicals and...
Yeah. Well, I think these fillers are a really good step because they give us something that we never had before, which is a sort of a reliable, predictable way to add volume back. We've used fat grafts, dermal grafts, those sort of things in the past, and they work well, but they require surgery. They require a sterile technique. They require a special technique in order to make sure it doesn't get infected and cause trouble. Right. Whereas these, they're done in the office. It's very simple, straightforward, and very little downtime. So what I need to add to it is a skin shrinking ray. If I could have that and the filler, I think my life would be much easier as a plastic surgeon.
Get the little elves working on that, and I'm sure people would love that as a Christmas present. Okay, there are some pictures that we brought, before and after pictures, and let's go ahead and take a look at that because really it's worth it.
It sort of lets you know what we can do. So
so what's going on here?
This is immediately afterwards. So this is someone who had a filler placed right into the nasolabial folds, those lines running from the nose down to the mouth. There you can see just a little bit of redness over the surface, which is easy to conceal.
But you no longer see those. What do they call them? Howdy doody lines, right?
Yeah, that's what my aunt calls them. But yeah, it makes them go away. And just smooths them right out.
That little redness around the area there, that goes away?
That goes away. Usually 24 hours, it's gone. What I'll have my patients do is use a little bit of ice over the area to keep any swelling down, and it seems to help with bruising also. It's also important to avoid anything that's going to make you bruise more during that week before the treatment. So aspirin, Motrin, Advil. Yeah, blood thinners are a bit of a problem with this. And
so would that be one of the contraindications of these injections?
It depends. Some of the blood thinners are being used, and people's INRs, or the amount that they're anticoagulated, is just double normal. They'll do okay, but they will have more bruising, so they need to plan for that.
Okay, you've got another picture here?
Sure, and very similar area. So again, this is treatments along the nasolabial folds and along the lip line. Sometimes there's little lines that radiate out from the lips. We can just put a small bead along the edge to smooth that out without dramatically increasing the size of the lips.
How long is this going to last?
The fillers last 4 to 6 months, depending on the filler. And depending on the patient. I'll have some patients where 3 months we're kind of wanting to do it again. I have other folks I see once a year because it's lasting that long for them.
And normally we see women, but this is clearly not a woman. This is a man. You actually have patients who come in.
I do have patients who are male, yeah. In the same area though, the nasolabial folds are bothersome for men and women. Men, we tend to have a little more dramatic line in that area. So this is someone who's coming in for maintenance. He's had treatments before. He's not going to let it get all the way back to where it was previously. And just 1 cc of Perlane is what I'm using for him. Works very well. Just fills in the area nicely.
I know people ask about this too. Does this actually stay in your system? Does it change your body chemistry at all?
It works locally. You can think of it like body bondo. It's just taking up space in that area. It's just filling it out, smoothing it out.
Body bondo. And now in this case, that's a great description because this is someone with acne scarring.
So acne scarring on the left is before, on the right is after.
Wow.
And what you can do with this, since it's you can direct where you're putting it, I can use it to fill in that area and help to smooth out the face. It's not perfect. If someone has very thick scarring and that scar is like a tether, like a button on a throw pillow, it's not going to let that skin pop up, and it's not going to work as well. You may need to go in and release some of that scar.
But what a wonderful thing for somebody who goes around and you might be self-conscious and to have that kind of intense scarring.
And there are 100 different treatments for acne because none of them are perfect.
Right. Okay, and
this is more lip augmentation. So the goal here was just to increase the size of the lips.
Now this is something you hear about a lot, where people plump up their lips.
And when it's done to normal proportions, you really can't tell.
You don't notice.
The folks we notice are the folks who have very large lips.
The codfish lips, the Hollywood.
And some people naturally have that.
Okay, now this is interesting.
And this would be a non-surgical rhinoplasty, what they're terming this now. But this is someone with a little bit of a saddle nose. The nose sort of dips in over the dorsum, the upper part of the nose, and you can use these fillers in that area to help smooth that out. And again, it's temporary. It does need to be maintained, but the results can be quite nice.
So a non-surgical rhinoplasty, This is something that, I mean, for people who are fearful about surgery, but want to make some kind of changes, is this that kind of middle step?
It's a middle step, and it can be a step towards a more permanent correction, or it can be something that's just maintained. And it depends on the amount of change that we're going for. Usually more dramatic changes require more dramatic measures, so more like surgery.